in order to answer that question, let me tell you just briefly a little bit about chemotherapy. So chemotherapy is a type of therapy. I know you've heard of it. Essentially what it is it's a toxin, it's a poison, and it goes into your body and it kills all rapidly reproducing cells, all the stem cells. And of course, we know that we're not big fans of certain chemotherapies or certain doses of chemotherapy, and we all would prefer to avoid it because it kills healthy cells as well as the cancer cells. However, it really does benefit some people, and for many years, it really did give people who had no other options an opportunity to live a longer life. In contrast to something that just kind of goes in like a shotgun and kills all rapidly reproducing cells, think of a targeted therapy as a laser. And it's like a guided missile. It's going into your body and it's looking for cells that have a specific mutation, the mutation that this particular targeted therapy has been designed to target. And it only affects the cells in your body that have that specific mutation. So it's far more effective and it has far fewer side effects as a rule. There's lots of different types of targeted therapy. You could consider immune therapy as a type of targeted therapy. There's all sorts of different kinds at like hundreds and hundreds right now that are available. The key is you need thorough genetic testing in order to be able to identify which targeted therapies you need. Most people have a handful of mutations that are causing their cancer, not just one, and most people require a large sequencing panel of your tumor DNA at minimum. We like to use a panel that's 550 known cancer-related mutations. Just note that. We have more than 550 known cancer-related genes and thousands of possible cancer-related mutations. And if your doctor is telling you you don't have any markers for cancer, or they tested you and you didn't have any mutations, I want you to understand that that means that they didn't test very far. They didn't look very far. They tested a very small number of markers. You absolutely have mutations that are involved in your cancer, or you wouldn't have cancer. Absolutely. And in order to be able to be put on the right targeted therapy, you need to have very thorough tumor DNA sequencing so that you can know all of your targets and get on the right combination and have the very best possible outcome that medical science can provide today.